Well, let's talk with Dr. Limongelli from Yonkers again here, general dentist. Let's talk about dental hygiene, brushing and flossing. Let's talk about brushes which are hard, brushes which are soft, flosses which are whatever they have some linements on it, they have flavors on it, they're not. Is there any good, any bad, and how should we go about doing it once we have the right equipment? Just give us the whole rundown, please, Dr. Limongelli.
Okay. Most toothbrushes, if there are multi-tufted medium brushes, work pretty well, like the Oral-B 40 or most of the multi-tufted medium strength brushes work very well. They're kind to the gums, and they do work very well on the teeth. The hard bristle brushes tend to abrade the gum tissue and wear it down. And as the gum tissue starts to wear down, you could get little cuts into the enamel around the necks of the teeth. They call them cervical abrasions. They're around the cervix or the neck of the tooth. And once that happens, you need little bondings to restore them. And it's most likely due to improper toothbrushing, horizontal toothbrushing. The brushing should be done in a circular motion rather than a back and forth motion. This is kind to the gum tissue, and it does a very good job of cleansing the teeth also. There are different types of toothbrushes. In addition to the manual toothbrush, they have the rotary type toothbrushes, which are battery operated. They work well. And as far as dentifrices go, or toothpaste, any good fluorinated toothpaste such as Crest or Colgate work very nicely in cleaning the teeth. You don't have to spend a lot of money, for very expensive toothpaste. It's just doing it, and at least twice a day, once in the morning and once at night before bedtime, are the best times to do it. And after you eat, if you can do it after you eat. If you can't, at least once in the morning and once every night before you go to bed.
Okay, so once you have, for instance, so is it better, or doesn't it really matter to have a manual toothbrush versus a electrical one? Is there really a big...
The manual toothbrush works very well. If you use it well, it does a fine job.
Okay, all right. And now let's go to flosses. First, actually, let me ask you, is it more important to brush on the manual, on the actual tooth versus the gum, or is it like half-half? Is it, because we know we have, like a carpet, we have the floor and the carpet and stuff gets in between. That's what, creates, the food, the chicken and the vegetable gets stuck between the teeth and the gum, and that's what then eventually creates the gum disease, because the bacteria grow there. So is there any specific technique when it comes to flossing to get as much as possible between the gums and the tooth?
Yes, flossing is the best way of getting material between the teeth cleaned out. And if you have caps, it's especially useful because it keeps the area of the margin of the cap clean, which is the part of the cap that's closest to the gum line. Flossing is good, and it should be done right after brushing. That's the best time to do that. And then twice a day, once in the morning and once every night before bedtime.
Flossing in the morning too, huh?
Yes.
You didn't need anything in between. What is getting stuck there?
It's a good technique to get into, but it is good to do it after meals if you can do it, if you're in a position where you can do it. But at least every night before you go to bed, to remove anything that you missed with a toothbrush that has accumulated there all day. In the morning, you can floss the same as you do your brushing. Naturally, you haven't eaten anything all night, but you still brush your teeth in the morning because it freshens your mouth up. The flossing will do the same thing.
I see. Okay. Now, there's also, some people, and I have lived a couple of years in India, and in India almost everybody has a dung scraper, and they're using that, and lots of people, including me, I kind of like use the toothbrush to kind of brush my my tongue and my gums. Now, is this something which is useful? Not really. What's your take on it?
Brushing the tongue should be a part of your normal oral hygiene. When you brush your teeth, you should brush your gums as well as the teeth, and you should brush your tongue as well. You eliminate a lot of bacteria that's accumulated on the little crypts in the tongue, and it does freshen the mouth. It eliminates odors in the mouth and the breath that way.
Okay, so that's what this is not directly connected to your teeth. It's just overall fresher mouth.
Yes, it's part of the oral hygiene regimen. They have little tongue scrapers that you can use that you can scrape the surface of the tongue with. But if you use the toothbrush, it'll accomplish the same thing, and you can do it all with the toothbrush. You don't need any special equipment.
Wonderful. Okay. Anything else we should know about brushing teeth?
As far as the oral hygiene goes, it works well. The only thing I'd like to mention is with bridge work. A lot of people find that it's very difficult to floss underneath a bridge because they can't snap the floss in between the teeth because the bridge is all one piece. They have little floss threaders which look like little plastic strips with holes in them, and you slip the floss in it just like the eye in a needle, and slip the plastic underneath the dummy tooth, and you can get the floss under it that way. Another way to keep bridges clean and crowns as well is with a mouthwash solution with a little peroxide in it. The peroxide helps to foam a lot, and it will foam anything that accumulates under the pontic or the dummy tooth of the bridge, and also freshens the mouth. And the peroxide that you get in the supermarket for cuts and scrapes is a 3% peroxide solution. It comes in a brown bottle because it prevents the peroxide from degenerating, which is light sensitive. If it weren't kept in a brown bottle, it would decompose into water very quickly. The peroxide also has a mild bleaching effect on the teeth and helps to brighten them. Most of the bleaching gels, most of the bleaching gels and solutions that you get that dentists use to whiten teeth are a peroxide solution. But it's a little more concentrated. They're anywhere from 20 to 30%. The 3% is not that strong. It won't do a dynamic job on bleaching your teeth, but it does help to brighten them.
Well, all right. That's good to know. Now, in fact, you mentioned something about when you have a bridge, which is basically usually three teeth where there's a cap on two of them, and the middle one was missing, and then it kind of hangs on it like the Golden Gate Bridge, I guess, and that tooth hangs on.
Just like any other bridge. That's right.
Right, and so you mentioned the difficulty about flossing there. Isn't that kind of like by not flossing or by not brushing? So that's when the food gets stuck there and the gum disease starts happening. And yes, I have heard that many dentists say that the areas of bridges, because people have a tendency not to floss there, create in turn gum disease in that area. And then the bridge basically eventually will fall out again, as the gums start decaying with it, the bones. Is that true?
Yes, it is, and it also creates odors in the mouth. With a lot of patients complaining of odors, the peroxide mouthwash solution usually helps that quite a bit.
Okay.
And naturally, the flossing underneath the bridge, if you can get to do that as well.
Yeah, but it does become more difficult, and most of us people, when it comes to these things, except, as I said, some people are obviously not lazy. I don't want to put everybody in the same thing, but the truth is, statistics apparently show that it's already difficult enough to get everybody to do the flossing, the brushing correctly, and the mouth and all that stuff, and then to fiddle with it and do this extra work on the tooth is difficult. So is that one more reason maybe why instead of a bridge, a person should have an implant, maybe?
Yes, it does make a lot of sense. You don't have the dummy tooth or the pontic to get underneath. The tooth is replaced directly by a little screw that goes into the bone, and it's just like any other tooth in your mouth, and it can be maintained the same way.
So you have the spaces in between like you would have otherwise, but with a bridge
yes.
You don't have that space.
That's right. And you can snap a floss in there very easily.
Wonderful. Again, thanks for the information. I think it is valuable and helpful to the people out there trying to stay healthy.
Thank you.
You're welcome.